Hi Vinas, hope you're doing good. So this is Dr. Srikanth from Team MDS CONQUER. Now in this video, I'll be discussing about the checklist as well as the topics and schedule of oral surgery. So coming to oral surgery is one of the easy, interesting subject, but it is a little vast. Okay, it's a little vast. And most of us during if you check out the final year subjects, most of us have a love inclined towards this particular subject, and of course you feel that positiveness when you're going through the topics of this particular subject. So it's a subject, a decent subject to start your prep. If you're starting the preparation with oral surgery, yeah, you're most luckiest person. Okay, so definitely going to be, because subject, like as you go deep into the topics, as you understand the topics, you can feel that positiveness towards the preparation, which is very, very important in the initial phase of your reading. And of course, oral surgery is one important subject in your final year, or one important dental subject, which is inclined to many other subjects. Like you see local anesthesia. Okay, so you check out local anesthesia. Local anesthesia is a part which is inclined to pharma. So it is integrated to pharmacology. You see temporomandibular disorders, in which we are going to cover anatomy of TMJ, which is part of your general anatomy and oral anatomy. And disorders will be covered in your oral path and oral medicine. So those things will be covered here. Same goes with maxillary sinus disorders. Okay, so basics of your anatomy and oral anatomy, general anatomy, along with the maxillary sinusitis and all those complications along with FES and everything will be discussed here. So which is integrated to many other subjects. You check out cleft lip, cleft palate. So it is combined, integrated with pedo and ortho, even GS. And orthognathic surgeries are inclined to your ortho subject. Pre-prosthetics are inclined to your prosthodontics. And of course, medical emergencies are inclined to many subjects like general medicine and oral medicine. Okay, so most of your questions in the final exam of general medicine will be inclined to some medical considerations and medical emergencies in a dental scenario. Then comes a little about space infections. Then comes all about fractures and instruments. So this is the rough schedule that you have to follow while you're cracking the subject oral surgery. And of course, I told you this is one of the final year subject which is inclined to many other subjects, and which is very, very important from examination point of view. Okay, I hope this is very, very clear. So now jumping into the scoring aspects. Yes, this is one of the subject which has high weightage, whether you're preparing for any sort of examinations. In NEET, official in the blueprint, it was given as 14 marks, but according to me, this 14 can range +4. Means that's what, like medical considerations, local anesthesia, and all these things are a common topics for many other subjects. So it may be around like 15 to 20 marks. And of course, if you're talking about INICET, this range varies, but I can definitely assure you that OS is a very, very major subject if you're talking about INICET, considering the medical emergencies, whatever it is. Like there will be lots of questions that turns around, like sometimes around it may hit 20 to 22 also out of 200 papers. Means 10% of your INICET paper will be moving around your oral surgery. Okay, right. So then jumping into people who are preparing for let it be national boards, or let it be ADC, or let it be INBD, or let it be any sort of ORE or LDS or something like OSCIS models and everything. So definitely, whether let it be in the part 1 theory part, or let it be when you're going for a bench test, or when you're going for part 2 of any of these, the practical part, medical considerations and medical emergencies are given highest priority. Okay, highest priority. Okay, so definitely you are going to have a strong n number of questions from these subjects, and OS is such an important subject to be done now properly. Okay, right. So now I'm talking about checklist. So when I'm talking about checklist, I cannot make a common checklist for both a repeater as well as for an intern. Repeater is going to have full time of preparation, where intern need to go to college and manage the college accordingly. And the reading hours of a repeater and an intern cannot be same. And even if you check out like interns from government dental colleges, they're a little bit busy in managing the patient. So I cannot even I cannot even tell that the interns from both the colleges will read same. Okay, it may not be possible in all the situations. So I have a basic checklist that everyone has to follow. Okay, and followed by, if you want to keep some add-ons to your basic checklist, that I want you to sit with the mentor. You can ping us, you can call us, we sit and we can add some extra stuff to your basic checklist. So reason why I'm segregating this basic and add-on checklist, the reason is, in the last 2 to 3 years, I'm seeing so many interns not able to crack the checklist, not able to do the checklist. Instead of trying hard to do the checklist, slowly, because of the commitments in the college, commitments in the culturals, commitments in the sports committees and everything, people started diluting their preparation and finally quitting the preparation. You check out like 5 years back, interns used to dilute their preparation but never quit the preparation. But this quitting of preparation become more trendy in the last couple of years. So that is the reason why I'm keeping a basic checklist, and I have modified the preparation pattern from the previous years to this year by giving the worksheet, decreasing your workload. Okay, because you see, like previous year students, they take lots of time to write notes, but now you don't need to write a notes is already ready. So it is something like you need to sit, open the notes, start watching the videos, underline the stuff, everything is prepared. It is something like cooked, well prepared. The only thing is you have to serve and you have to eat it properly. Okay, so I'm going to give a basic checklist. The basic checklist, the first part is going to be your worksheet plus smart videos. The basic one is your worksheet plus smart videos is the first step. The second step is I want you to finish the Q bank. So Q bank is something like worksheets are something which are exclusively introduced for 2026 batch of MDS CONQUER, and Q bank is something which is introduced first time for 2026 batch. Okay, so I want you to finish the Q bank. So while you're solving a Q bank, for example, a topic you're solving, exodontia, you may have 25 questions in the Q bank, out of which some 15 to 18 or sometimes 20 questions may be within your zone. That can be your exposed clinical scenario, or you may have a knowledge regarding that, or those things will be covered in your worksheets and smart videos. And the leftover questions, that is 5 to 6 questions or some XYZ number of questions, can be application part of whatever you have done in the smart videos, or can be some minor new concepts. So now learn them and add them to your worksheet. So these are the first 2 steps that any one of you have to finish it at any cost. Okay, make sure, like, this is a basic thing that anyone have to crack it. Okay, next, coming to aspects apart from these. Okay, so aspect number 3. Okay, aspect number 3 is, okay, particularly if you're a repeater, or if you're an intern having more time, or if you are posted in a department where you have more time to read, I want you to do MCQs from as many sources as possible, basing upon the time limitation. And I don't recommend you to do from multiple number of books. Either you can keep one book, okay, one preferred book of choice, and you can plan your solving MCQs from that particular book. Okay, underlining the stuff which are not pointed or not covered in the previous readings, or you don't have any knowledge regarding that, such an aspect has to be done. I strongly recommend either you can go with dentist or dental pulse, basing upon your convenience, but this is not mandatory. Okay, this is not in the basic checklist. I'm very clear, this is not in the basic checklist. I want you guys to focus on the basic checklist. If you're done with the basic checklist, because your exam is in 2026, if you're an intern posted in a department with more OP, if you're an intern posted in a department with more OP in a college which has more OP, okay, or if you are not able to manage because in this particular month or in this particular week you have some personal commitments with the family or some college events are there, everything are accepted, but make sure, I want you to crack the basic checklist. Okay, whenever you have time, then you can cope up with this part, this add-on part. Okay, you can cope up with this add-on part. Okay, right, so don't break your heads. First, focus on the basic checklist. You have time, for example, on a weekend, on a long weekend, you have a public holiday, or you feel like you have a Sunday, you want to use the Sunday properly, then I want you to sit with the MCQs of dental pulse and dentist, which is definitely add-on. It's add-on, it's not mandatory. I'm very clear. Intern, it's not add-on, it's not mandatory, it's an add-on. You do it, it is an advantage. But if you do basic checklist, mandatory basic checklist, following the schedules, that is going to turn your preparation into a better version. Because once you're done with an internship, or once you take break from the college in the last 2 months, or you take a break from the college in the last 2 months, or you complete your internship ahead of your exam, so those 3 to 4 months or 4 to 5 months is sufficient to solve MCQs. Okay, if you cannot do that now, you can do that at that time, but those 2 to 3 months cannot be sufficient to watch the videos, to watch the worksheet. Okay, so videos, worksheet, and everything are something like the core, which you have to keep them as a priority now. Solve them now. Okay, so this comes under basic. I want you to focus on basic. And of course, the next add-ons are going to be your WhatsApp activity, okay, which we'll be doing on a regular basis, like a quiz mode in the evening session. We'll try to solve some 10 to 15 questions of the topic of that particular day. Okay, right? So that by which we exchange some ideas, exchange some energies, drop some motivations and everything. And followed by the last but not least is this is pro live sessions, which are only for the pro live students. So for OS, I feel like we will be going ahead with 4 sessions, and the dates will be announced very, very soon. So it will be evening from 6 to 7:30 or 7:45. Okay, right? So I want you to attend this pro live sessions live. So in this 4 sessions, I'll try my best to cover some 180 to 200 concepts. We'll be discussing some 180 to 200 concepts, the latest questions which are given in the examinations. We will try to discuss 2024 NEET or 2024 NEET questions, or even the recent INICET 2024 November INICET questions, and all those questions, integrated concepts, how it is inclined to other subjects, some clinical scenarios, some life examples, and everything will be discussed in the pro live sessions. Okay, right? It will be from evening 6 to 7:45. And even if you miss the live session, it will be available as a recorded version for an unlimited watch. So everything in MDS Conquer is an unlimited watch. We don't have limitations here. Okay, right? So I hope this is very, very clear. So this is the rough plan of your OS, which we will be doing in the upcoming 2 to 3 weeks. Okay, good day, study well, take care. Any doubts, you can drop in the comment box, or you can simply, okay, no need to drop in the comment box. You can directly reach me. So I'm always available for you. Take care. Signing off, Dr. Srikanth from Team MDS Conquer.